belied what was actually quite a long history of innovation at Intermountain. The organization had been one of the first health systems in America to establish an insurance company, to create a medical group, and to move toward electronic medical records. Nevertheless, a belief had taken hold in parts of the organization that fundamentally transforming Intermountain at this point in our evolution would be misguided, even dangerous. I saw it differently, as did Intermountain's Board of Trustees and its previous leadership. As much as Intermountain had already accomplished, an opportunity existed for the organization to do even more, ratcheting up its innovation and in the process leading much-needed change across the entire healthcare sector. Despite decades of talk about reforming healthcare, our industry was still mired in an outdated, inefficient, and less compassionate fee-for-service model. It was a familiar system that the industry couldn't seem to escape. Under this model, key metrics such as patient experience, quality, and safety lagged, and caregivers focused on taking care of people once they got sick, not on preventing them from getting sick to begin with. Newer value-based care models rewarded healthcare systems for delivering better quality care, not just a larger quantity of it. One of these models, population health management, went further and compensated healthcare systems for taking care of patients on a per-capita basis for a period of time rather than only for providing discrete episodes of care. Using this approach, we would essentially share the risk of taking care of patients. Insurers would pay us a certain amount per patient to provide for their care. If we could provide care for sick patients at lower cost, and if we could keep patients healthier to begin with and minimize their need for expensive healthcare interventions when they got sick, both patients and the healthcare system would benefit. Instead of receiving payment based on the specific services we provide, we would receive compensation based on health outcomes we deliver for a given population of patients. Such arrangements would incentivize us to keep people well, not just care for them once they became sick. These newer models are the future of healthcare, poised to displace the older fee-for-service models. The latter models were bankrupting America, even as they compromised the health of its citizens. Since healthcare providers under fee-for-service got paid based on volume, they benefited financially by seeing more patients and performing more procedures, not by improving what they did. They had little incentive to innovate in ways that would allow them to operate more efficiently, improve the quality and safety of the care they provided, make care more pleasant and convenient for patients, or help keep patients well and out of hospitals. Given how unsustainable the existing model was, Intermountain, prior to my arrival, had already begun a bold transition toward value-based care and population health. Since 2011, movement toward these models had been a C-suite priority and board-level goal. We had established an entire department and team dedicated to the transition and to pushing the deeper changes it entailed inside the organization. These efforts had borne fruit. By the time I arrived, 20% of our revenue derived from outcome-based payments under the population health model, far more than at most other leading health systems, and a testament to our efforts in this area. And yet, we needed to do far more. As members of our board and others at Intermountain saw it, government policy would increasingly depart from the fee-for-service paradigm, putting pressure on big healthcare systems to adapt. New players in healthcare were also beginning to nibble away at the business of healthcare systems, finding new and better ways to deliver specific services. Observing the appearance of nimble startups, it seemed clear to us that most healthcare providers operating under fee-for-service, including Intermountain, were like Kodak, BlackBerry, or Blockbuster Video, big lumbering incumbents that would become easy prey in the years to come. The choice was ours. Adapt now or consign ourselves to an early death. Disrupt ourselves or wait to be disrupted. My cancer diagnosis left me with an even greater sense of urgency.